Flurona. It's when you have the flu and the coronavirus at the very same time. Recently, doctors in Israel reported 2 cases of this happening with pregnant women. Channel 3 Eyewitness News reporter Sharon Johnson spoke with doctors about Flurona and whether it's a cause for concern. Sharon.
Well, Aaron, Flurona is a new word, but the conditions aren't new. That's when people get COVID-19 and get flu at the same time. Now, doctors say right now it is rare, but it's not impossible to get both.
Flurona is indeed double jeopardy. It's not the two illnesses morphing together, and it's not a new disease. It's just the two infecting the same body simultaneously.
In Asia, they have done some studies suggesting 4.5% of individuals infected with COVID also are co-infected with influenza.
In the U.S., doctors have reported some people with Flurona in Texas, Florida, and California. Health experts I spoke with say right now, not many people are testing for both, so it's still not a common instance. But still, they say this season's flu season isn't as calm as last year's, so it could happen.
It's not commonplace to happen, which thankfully, but it could happen. Now that we're really in flu season at its peak, we have to be very careful.
COVID-19 and flu symptoms are similar: cough, fever, body aches or chills, sore throat. Quinnipiac University professor Pepperitis says people with any respiratory symptom should get evaluated. Experts still don't know how bad having both at the same time could be, but they say it could be severe.
It can become a pretty significant infection when you have 2 viruses kind of competing at the same time.
To prevent it, doctors say get vaccinated. And for children too young to get vaccinated, Yale School of Medicine Dr. Magna Diaz suggests making sure everyone around them frequently is vaccinated.
We've had quite a few babies who are newborns just in the first few weeks of life who have gotten admitted, unfortunately, for COVID. So for those patients, I would say really limiting visitors.
And of course, doctors also recommend getting your COVID booster shot, and flu season runs until March, so you still have time to get your flu shot as late as the end of January. Live in the newsroom tonight, Sharon Johnson, Channel 3 Eyewitness News.
Something else to think about right now, Sharon. Thank you very much.